The grassroots effort that this started with was such a great vision. And the fact that it's grown so much is such a huge accomplishment for this group because everything at the national level, the state level became so siloed. You didn't have different groups talking to one another. They might be collecting survey data for different things, not communicating, putting out similar surveys. It's very frustrating when you see those silos and that lack of communication across those agencies. So at the local level, I think that we were able to see this and realize how important this is to us. So having this brought to us, having the ability to come together and have standardized survey questions was at the forefront for us. Like I mentioned before, also, you don't want to have to start from the ground up again and again when you're creating surveys. So having this a platform has really enhanced the work that we're doing.
Today, we're excited to interview Jackie to talk about the LHD Academy of Science and to learn about the impact that it's made within Maricopa County. For those that don't know about the LHD Academy of Science, the goal of the organization is to come together across 3,585 local health departments across the nation to, number one, stop hiding our measurements across all these random survey logins. We've been creating them in SurveyMonkey and Alchemer and Qualtrics and RedCap, and it's hampered our ability to measure the same way. And so we've come together to, number one, purchase survey software at a reduced rate as a group and have a buying committee to do that. Number two, to create a state level library so that we can organize them according to categories so our local health department data collection people can find them. And then number three, to have a national level library. We meet together monthly in our 14 AOS states, and we wanted to interview Jackie, a founding member and also a part of the AOS board. Without further ado, here's the interview of Jackie. Thanks.
Jackie Ward. I'm from Maricopa County Department of Public Health, located in Phoenix, Arizona.
When did you first recognize the problem of non-standardized data? You obviously were probably in the health department one day, maybe.
So when I started in this role, I got involved with our community health assessment. So in doing that, one had been done prior to my start, but we were looking at moving into the next round of our community health assessment. And I was really evaluating the survey we had done. We had only a few, several hundred responses, whereas Maricopa County has millions of people living here. So trying to be representative of the community. I was looking to see what others were using for their surveys for community health assessments, and it was really difficult to kind of find some of that. And then trying to look at how we can compare to other counties, not just in Arizona, but throughout the US, that would be similar in size and scope as Maricopa County. So that's when I recognized that, there's no central repository. And then looking at it, it's everybody asks the questions differently. And so how do we really get onto the same page and ask similar questions to one another? You can look at the BRFIS and be similar to that, but overall, there was no easy way to compare yourself to any other counties' health departments that were asking survey questions. And so then that exploded into other arenas and other questions and surveys that we do throughout the department.
So taking it a step further into the state and then nationally, and knowing that there's 3,585 people like you that are sitting into a computer at a health department, logging into some software and designing their own. Why nationally is that a problem? Like, for our nation or for our citizens that move from state to state or county to county, and
you're not able to compare apples to apples. You're really looking at your own community and asking your own set of questions, but when it comes to looking at things from a broader perspective and even gauging where you are as a community in health, having standardized questions to do that comparison allows you to see, okay, where are we at in comparison? You know, the Healthy People 2020, 2030, they have certain standards, but that's across the entire nation. If we want to look locally, we need to set our standard to something that is more comparable to communities of our size. So I'm not going to compare my community and my community's health to a community of, say, 50,000 people. In a very rural community, when Maricopa County is so large, very diverse, it's urban, rural, there's a mix of the community that we have. So we really need to be able to look at others that are similar to us for that comparison.
Maricopa was one of the first counties in America to kind of jump on to the values of AOS. And one of the number one values is measurement transparency. We talk about the 3,500 creating measurements, and that step of maybe we should be putting them in a common national library and being transparent and opening yourself up to say, this is how I measure. Why is measurement transparency important to Maricopa County, but also to you?
The measurement transparency is a huge step forward for all of us. You have the US that is very diverse. Maricopa County is very diverse, and we want to be able to ask questions similarly, and trying to find those individuals that are asking questions, doing a CHA, reaching out to community members on certain aspects of their health. Why start from the ground, the bare dirt, and have to develop everything yourself? Why can't we have a central location to go to share with one another? And so AOS has provided us with that opportunity to say, okay, I'm looking for this kind of survey. Where can I go? Okay, I can go to AOS. I can look in that repository that we've created. I can look for this subject or this area of health and find surveys that have already been asked. So being able to do that saves time and resources, which is huge for me. When I first started, I had maybe 3 staff members. Trying to do all of this within our small team took a lot of time and resources. So being able to reach out and see this has been a time saver for us, not just with community health assessments, but other aspects of our health data.
The AOS board has said that the AOS measurement library should be there to strengthen and be for free for anyone that needs access to it. And that it could be there to support national associations like NACHO, CSTE, FAB, or others, because we realize those organizations are going to be the voice for local public health. And we feel that they would need a standardized measurement set to represent, maybe talk, why should national organizations get into the process of maybe we can help trying to find agreement on these measurements? Why do we want to have such an open look? We don't own this. We want the industry and these national organizations to be a part of it.
So why not have a central repository for survey questions so that everybody can look to that for their questions, have them be somewhat, if not the same across the board, so that we're doing things the same and can do that comparison much easier. And even for community members, I mean, if I move from Maricopa County, say I go to New York, if we're asking the same questions, then you become familiar with it and you get more trust built in the community because you're asking the same standardized questions no matter where you are, and how you're defining things are therefore more comparable. CSTE with their definitions has made great headway in making sure that all health departments are defining things the same. So that makes it much easier to say, yes, we have the same protocol for defining this disease, or we have the same standard survey questions that we're using to gauge the health of our community.
AOS has made a very strong decision to be technology independent, meaning we're not here to sell a technology. We're committed to using the best technology for data collection, but we want to safeguard against technology practices that would have us silo or hide our work. But we're also committed to reducing the cost as we buy in bulk, or even eliminating it to making it free for all members. Why is that safeguard so important to be in place to kind of engage the technology community, but really protect the science at the same time?
So technology is wonderful. I'm sure many of us are like, you love the computer, you love technology, and you hate it at the same time. But there's so many different companies out there. There's so many different levels of licenses that are available, that by having it be in the platform or different options for different size health departments really opens it up to all health departments. It's a group effort to bring down that cost and put us on the same page. Maricopa County is huge. We tend to be able to afford some things that our smaller health departments, even in the state of Arizona, cannot afford. But why is there that cost difference? So coming together with AOS, having that buying power to reduce the cost to everyone has leveled the playing field so that all of us can be in a platform that has all of the same features. And then the sharing capabilities, if somebody is using one platform and another health department is using another one, trying to share those surveys without having to recreate it in your own platform is a time saver as well. So there's so many aspects of this collaboration that we've been able to build that is really beneficial to all size health departments. And it really has opened the door to providing that opportunity of sharing, standardizing the data, coming together and having a venue to discuss these measures. It's just a win-win.
The AOS board has voted to have a buying committee where the AOS members themselves pick 100%. Why should that power be in the members' hands?
The AOS board members and membership, because it is bringing together so many diverse groups, having the ability to allow everyone to have a say in the software that we utilize ensures that we are getting buy-in from all of them. To have one individual or one small group make that decision could cause some issues. Somebody could say, oh, well, you know them, you already have a relationship with that group. That's why you picked that one. No, it comes down to everybody gets the option to choose, put their voice, let their voice be heard. And it really makes you feel like you are a contributing member and you have a say in what's going on within the AOS. So having that option is just, it's wonderful for everybody to have a say, because there could be things that, with our current platform, maybe we're missing something. And somebody is working with this platform that maybe some of us haven't heard about, and they bring that forward. And it's like, oh, well, we didn't know about that. Let's look into that and see what the options are, see what the cost is. How can we work this out? It's a wonderful relationship that we have in coming together with AOS to do this.
Another AOS value is scientific debate. Prior to AOS forming, we've talked about how the members would develop measurements and then hide them. So that also entails that we weren't really at a local level peer reviewing or throwing our projects to our counterparts next to us and really improving the science. And this is a core value for AOS. Why, as AOS members, should we foster a place of, and across nationally, why should there be this national debate of these measurements to improve them, like the science of it?
Coming together, like the scientific debate is a huge aspect of, public health. It has helped drive so many improvements in the overall community's health throughout history. But it all has to be supported, and all has to be reviewed. So having the ability to share out these measures with one another, have them reviewed, have them tested, really drives the honesty behind it, and the information that we're gathering is robust, is going to be a welcome piece of information to our community's health. It's really key, a cornerstone to the work that we do, having that scientific debate. And it's healthy. You get lost sometimes in your own work, in your own question design, your own methods. So having this opportunity, I think, really makes it more robust, and you have that backing from the group to say, yes, we tested this, we've shared this, we know this is what has worked.
Reducing measurement duplication, across this nation. I think each health department wants to be heard by their state, but they also want to be heard nationally. Yet we throw 3,500 duplicative measurements up, and yet we serve the word in the last interview was indigent care, that we service a population that sometimes are minority for the most part, or underfunded. They're struggling, and yet they're thrown a lot of measurements of like, hey, you should stop smoking, you should go to the gym. Whether it be the citizens we serve or the policymakers in DC or in the state, why do we need to be focused on reducing the overall amount of duplicate measurements?
So there's just been a state of constant surveying of specific groups, and those groups don't ever get told the results. And so you have, maybe a university going in and surveying a population, you have the health department going in, you have the hospital going in and interviewing, trying to gather basically the same information, just in different ways, and asking it in different ways. So by standardizing it, we can say that we're going to go in once, and ask these types of questions. We're going to provide the feedback to the community, because you can't do work in a community to improve their health without their input. And questions through surveys, focus groups, key informant interviews, those type of things are the best way to get that information. You can't say, well, this population has a really high case rate of diabetes. Well, yeah, but you can't go and tell them you need to cut back on your sugar and so forth. You need to look at that holistic approach, Why are they having these high rates? Is it because they don't have healthy food options nearby? They only have fast food, they only have corner stores. So it all comes together to give that better picture. And if we can standardize these across our health jurisdictions, it's just going to be a better view of the community as a whole, because you can say in our community we're this, in the state we're this, and then nationally we're this, where so many surveys that are out there are different, or they only ask them at a national level, they don't, or they only ask them at a state level. You can't get granular with them. So if we can standardize, we can do that comparison much easier, and show what we're doing and how we're approaching health improvement.
You sit on the AOS board, and we've said that every health department matters, and that, which is very unique because you work in Maricopa. You could easily just say, we're funded, we're great, let's just get together with those that have money, the largers, and we'll come up with our own measurements and we'll move forward. Yet this movement is, over half of AOS members are grant funded now, and they don't pay anything. And why in this movement does every health department matter, and that we say you need to be at the table and we're not going to leave you behind?
I've said before, we're a huge county. There are many small counties. Smaller counties don't have the manpower, the resources, and quite possibly the funding to always get involved, always be able to participate in groups that cost any amount of money. It could be $5 or $15,000. That's going to hit their budget, and it's something that they couldn't do for the community. So having the grants, having the ability for all health departments, no matter what size, participate is a great piece to this AOS group. We are all able to come to the table and represent our communities, no matter the size. Maricopa County is probably so huge. We encompass the largest portion of Arizona population wise, but there are other counties here that need to be represented. They are trying to do the same work that we are doing on a smaller budget and much less staff. So why not bring them to the table? Why not offer a grant or an opportunity for them to participate and have the same resources that we as larger health departments have? Everybody needs to come to the table and be able to share their knowledge, share their information, and not start from the ground. It's so time consuming. And if they can go to that bank of survey questions and pull a survey from there to use, why not? Why not make it easier for everybody to do that, so that we can all really enhance the work that we are doing in our communities?
Why do state health departments play a role, and also CDC? Like, what would you say to, not your state, but every state, why should they engage? Why should a state be involved in this? What I mean, it's the local health department's problem. Who cares? I can measure a problem by myself, and I don't really need to consult with them. Why should a state be involved?
So, state health departments play a big role in the state and with the local health departments. A lot of the states provide guidance and leadership to the counties within their state. It would be great to have Arizona State Health Department involved in our work, because they are integral to this. They're doing a statewide health improvement plan. They're doing statewide surveys, but they're also sharing some of that to the local health departments, but not enough. So having them be involved just enhances the work. And I think personally, it would build the relationship between the local health departments and the state health department to see how well they can come together and work on community improvements to health. There's so much that can be done when you come together versus working in your own little silos. So I really feel that it's important that the state health departments and the states that have gotten on board with this and provided those grant opportunities to the small health departments throughout their state, I say that is amazing work. And it's great to hear it. Anytime you've come to the board meetings and announced that this state is doing this and we have this many more members, it's huge to building that relationship between the counties and the states and to see what can be done. I'm looking forward to the coming years and seeing the work that they get done, how they're helping one another, and hopes that, with the change going on in Arizona, that we can see some of that opportunity here as well, because there are smaller health departments that could really use this group and use the information that we have and that we're sharing to enhance the work they're doing.
Process. Yeah. What advice do you have for someone that doesn't have 30 years of experience like you, that says, what should they do as what would you, as a data collector, what advice would you have for them?
As a new member to AOS, I really suggest spending some time meeting some of the other members, talking to them, maybe seeing if you could attend a board meeting and hear the discussions that are going on. But number one, looking at what is available to you. There are so many departments now participating that you could look at just others within your state or within the nation, and look at what they're doing, what they're measuring, how they're measuring. And there's context within there. So you can reach out to them and ask for additional information, or, hey, I saw that you have this survey and I need to do something similar. So can we meet and maybe talk about this and go from there? Those that are involved in the AOS love the AOS, and we want new members to feel welcome and feel like they're able to reach out to us. I always get a kick when out of getting emails from someone saying, hey, I saw your name at this event or on this presentation, or on this board or this group, and I wanted to get kind of talk to you and maybe see if I can get some information from you or get a survey from you. And it's great. That's the point of the work we're doing with AOS, is to share and not reinvent the wheel. So reach out, ask for help. Everybody's willing to help.